Good morning, everybody. First, let me apologize for arriving late. I've had a very busy morning already, but I just could not miss this event because I feel so strongly about being on the team to fight diabetes. When I was first elected to the Senate, one of the first constituent meetings that I had in 1997 was with a family in Maine whose son had type 1 diabetes. And I'll never forget this little 10-year-old boy looking up at me and saying that he just wished he could take one day off from having diabetes, his birthday or Christmas. That touched me so deeply that I came back and I talked to my health policy aide, and I said, is there a diabetes caucus in the Senate? And she said, no, only in the House. And I said, well, guess what? There's one now. And I founded the Diabetes Caucus. And today, I am so grateful to have as my co-chair Jean Shaheen from New Hampshire, who knows firsthand from her family's experience what it's like to have a grandchild with type 1. She has been a wonderful partner, and we've worked together because diabetes doesn't care if you're a Democrat or a Republican or a Green or an independent. It can strike all of us and any of us. I must say that it's so exciting to be joined by these amazing athletes and by Mike, who my husband watches every day, Mike and Mike. He was so excited that I was going to see you today. It has been said that the United States Senate is a body of 100 individuals united by our dislike for our colleagues' home teams. As a New Englander, it's probably not too hard to figure out where my rooting interest lies. And speaking of the Patriots, Dante, I want to thank you for your great advocacy on this issue. Your family, like so many others, has been hit hard by diabetes. And working together as a team, we can stop this terrible disease in its tracks. I notice as I talk to people about diabetes that oftentimes they simply do not realize what a serious disease it is and that it affects every system in the body. It's essential that Congress play a key role on this team by supporting the vital research to more effectively prevent, treat, and eventually cure a disease that afflicts nearly 30 million Americans, along with 86 million with prediabetes. In addition to the human toll, diabetes costs the United States an estimated $245 billion a year, a cost that is projected to more than double by the year 2020. Diabetes also accounts for 1 out of 3 Medicare dollars. In fact, medical costs for Americans with diabetes are more than double those incurred by individuals without diabetes. Since I founded the Senate Diabetes Caucus in 1997, I'm pleased to report to you that funding for diabetes research has more than tripled. And that would not have happened without the advocacy of the ADA, and also the JDRF, and other groups that have come together. It would not have happened without all of you who are in this room. I'm very excited about new results that we have just gotten from the federal government that shows that interventions work, and the special project with the YMCAs to help adults with prediabetes achieve a healthier lifestyle has been shown to save money. In fact, the recent findings are that it yields cost savings for the Medicare program of $2,650 for each enrollee over a 15-month period. So that's a major step in our goal toward prevention. For young people who have type 1, what a difference I have seen over the years in the changes in technology. So do you have a little pump?
Yes, I do.
I bet it. That's what I thought. See, that's so great. Do you know those used to be huge and not nearly as effective as they are now? And we have continuous glucose monitors, which Jean Shaheen and I are determined to get Medicare to cover. Yeah. And that is so important. It makes no sense at all that Medicare doesn't. Most insurance companies do, and this is just out of whack, and it's something that we're going to continue to work on. In football, continued progress is called moving the chains. As a member of the Senate Appropriations Committee, I've called upon my colleagues to keep the chains moving by maintaining our strong commitment to biomedical research in the upcoming appropriations bill for NIH. And we know that this research is responsible for breakthroughs such as that nice small pump. So I am convinced that today's investments will yield cures and therapies for patients tomorrow. As the chairman of the Senate Aging Committee, I'm also keenly aware of the toll that diabetes takes on older Americans. I have chaired 8 consecutive children's congresses on juvenile diabetes, and I've seen how the disease affects younger people and their families. So across generations, the importance of more research dollars to prevent, treat, and eventually cure diabetes is clear. And thanks to your advocacy, that goal is within reach. Thank you so much for the opportunity to talk to you this morning. Thank you. Thank you.
She's getting a book too. She's getting a big book.
So before you leave, we know it's a busy day for you, so we just have a little something for you. So I am Maggie Powers, and I'm president of Healthcare and Education with the Diabetes Association this year. So we really appreciate your work as a champion of diabetes. It helps so many individuals and families, as we've heard, like the ones we've heard of, and this is just a sample of the many who are passionate about research for a cure and programs to prevent and better manage diabetes. So we, as the Diabetes Association, have asked people to sign a petition at our request for more robust funding for the National Institutes of Diabetes and Digestive and Kidney Diseases, CDC's Diabetes Translation Division, and the Diabetes Prevention Program. So we have had over 79,000 people signing this petition.
That is incredible. That is wonderful. Congratulations to you.
So they.
That is great. You know, that has a real impact. It really does.
Yep.
That's great. I'll bring that to the appropriations hearing.
Great, thank you.
Thank
So
you.
they're all behind you, supporting you.
Thank you.
you.
That is wonderful.
Okay.
Thank you so much.
Senator Collins, thank you so much again for being here and for your time and for your words.